Hey, good afternoon, everybody. Good afternoon, Mutturajati madam. I'm Dr. Renu speaking from Curi. I would like I hope you all enjoyed this Cure education program. This is basically meant to upgrade your basic knowledge about urology. Couple of things I would like to request you to mute your audio and video. What we have out the last few sessions, a lot of people don't mute it. And say technology has its own limitation. So because of it, so much of disturbance, it causes problem for us. So தயவு செய்து உங்க ஆடியோவும் வீடியோவும் மியூட் செய்யுங்க. நீங்க ஆடியோ வீடியோ ஆன் பண்ணாதான் உங்களுக்கு கேட்கணும் கிடையாதுங்க. இன்னைக்கு செஷன் ஸ்டார்ட் பண்றதுக்கு முன்னாடி ஒரு சில விஷயம் நான் சொல்ல விருப்பப்படுறேன். Mrs. Mutturaj Madam, she is an assistant professor in Ganga College of Nursing. What we have planned is, since we are giving you, discussing the information, how much people are able to grasp and where we should do our next session. After 5 days of session, we have planned to evaluate you all. This evaluation we are doing it online. It is conducted on Kahoot app. So, Ms. Prajati Madam will give you the detail about how to use Kahoot, what is the way you can reach, and when you give your answers, you can assess yourself. There's no secret about it. Please do not get scared. It has nothing to do about your assessment alone. This we are doing that we ourselves can see how much you people could understand, and if any change we want to bring in our program, we would like to bring it. Mutturajati madam, you can take over and please do explain about Kahoot. Thank you, madam.
Good afternoon all. So I hope the session, online session is going well. So today what we have planned is to conduct a quiz. As ma'am said, we are going to evaluate how the session was. So for this, we have instructed you to download Kahoot app in your mobile. So I hope everyone have downloaded. So what the instruction is, the quiz questions consist of 25. In that 25, we have a format of multiple choice questions, open-ended questions, true or false, and identify the instruments and pictures. So in that, before you are entering into the Kahoot, what I'm instructing you is, for multiple choice and true or false, you can select the answers. Then for the open-ended question and for the identify the instruments, you have to type the answers. So each question has its own time limits. That is for 30 seconds, 20 seconds. According to the question format, you have a time limit. So before the time, faster you answer, the higher the scores. So how fast you are answering for the question, you will get the highest score. So what are the instructions? The first one, you have to download the Kahoot app in your mobile. Once you have downloaded, in the front page itself, you will get a notification that no need to sign in, directly go for the challenge. So if you have entered into the challenge page, you will get middle of the home page, you will get what is enter the game pin. So we will share the pin by 3:30. So where it is around an 8-digit number. So you have to enter that 8-digit number in the game pin. Once you have entered, it will open the game challenge page where they will ask you to create your nickname. So the nickname, as we have instructed you earlier, that is, you have to enter your nickname, that's for create your nickname as along with your institution name. So that only we can able to easily identify who are all participated, then who got highest score and everything. For example, you can create as Curi Satya or Ganga Muthu, like that. You can create your nicknames. Once you have created a nickname, there was an option that go now. So if you are clicking the go now, you have completely entered into the quiz. So the quiz, or how the format will be, once you have started the quiz, the first question, that is the open-ended question, if it is so, the open-ended question will start. So the first question, first the question will display, read the questions clearly, then you will enter into the answer section, where you have to put your answer. Once you have typed your answer within the stipulated time, it will show whether the answer is right or wrong. If it is right, whatever, whether it is a right or wrong, it will give you a color code. That is, if it is right, it is green. If it is wrong, then it will be in a red color. Then they will also show you the what is the correct answer. Then you will move on to the second question. So like this, the 25 questions will go in an order. So once immediately after your answer for each question, you will get a replay. That is whether the question is right or not. So once you have completed the 25 questions, you get your report, how many questions you have completed, then how many questions you have attended, what is your exact score. So what are the few limitations in this app is, one thing is the pin will be valid only till 5 p.m. today. We have created in that way. So you have to participate, but you have to start your quiz by 3:30, then you have to complete as soon as possible. So each question has its own limit. So you can't able to go beyond that. So it will be, the pin will be expired after 5 p.m. today. Second thing, only 2,000 participants can use this pin. So kindly all of you create your name as a, that is as a participant, you have to create your name along with your institution name. So all the best all of you. If you any difficulties you are facing in entering the pin or any technical support you need, kindly send a message in the chat box. Thank you.
Good afternoon again. I hope you have understood what Mrs. Mutturajati has told. Please do not get scared. This is, you have to concentrate every session. Don't take it lightly. Now, today's topic of discussion is going to be prostate enlargement, benign and malignant. Our speaker today is Dr. Ananthakrishnan Shivaraman. He is no new face program. He is our director of Curi, Chennai Urology Robotic Institute. He is a consultant robotic surgeon in Urology, Uro Oncology. He has lot of accreditation behind his name. One of the prominent things is a proctor for robotic surgery in India. A proctor means he has been given the authority to train the people in robotic surgery. Fortunately for doctors, there is a fellowship program. Doctors can get trained under doctor and they can perform robotic surgery in their own institute. We ourselves have started 2 fellowship programs for robotic surgery. Unfortunately for nursing, there is no certificate program available where they will be in robotic surgery. Since the future is robotic surgery, over a period, the younger generation, it is better if they get exposed to robotic surgery. Due to advantage of robotic surgery, where your stay in the hospital is minimum, the precision of surgery is good, and outcome results are better, everybody would like to go for robotic surgery. And fortunately or unfortunately in our country, there is no balance between availability of logistics, availability of expertise, and nursing support. Either we have new instruments, new technology available, then we don't have somebody to run it, and then if somebody is there to use it, we don't have support system. To make you nurses aware of, we have started this education program so that the fear, inhibition about robotic surgery can be minimized, can have exposure. That's the reason at the end of 10 session, we'll have online interview so that the interested candidate and the selected candidate can come to Curi for 2 weeks program for hands-on experience. Dr. Anand is a founder of Indian Prostate Cancer Foundation. This is the foundation he created to create awareness about CA prostate and create awareness so that we can detect it early and outcome will be better. End of this program, as usual, you will have quiz question also and question on feedback. These 3 questions are not marked in today's assessment. Those are separate and this is separate. So please enjoy this session. This is very informative session. Please listen to it. This is one of our major session. That's the reason first 4 days we give intro to robotic and about urology so that you can understand this. Please go through this session. If you have any difficulty, you can raise your queries in chat box. The speaker will answer you then and there so that everybody can clear their doubts. So I hereby request Dr. Anand to start his lecture. We all will get benefited. Thank you very much.
Good morning. I'm sorry, good afternoon. Welcome all to this session. This is Dr. Ananthakrishnan, urologist. Dhanashekhar, am I audible there?
Yes, sir. You are audible, sir.
All right, okay. Thank you very much for attending the session on benign prostatic hyperplasia. Is the screen visible there as well?
No, sir.
You're not able to see the screen?
Yeah. Now
we can able to see the screen, sir. We can't able to see you.
Okay, one second. Okay. Okay. Right. So today the topic is benign hypertrophy of the hyperplasia of the prostate. So first, what is the prostate? Where is the prostate? What is the prostate? That question needs to be answered. And the first is to find out where the prostate is. I'm going to show you just a small video. Are you able to see the screen? Everybody with the prostate gland here, or yes or no?
Yes.
Yes, sir.
Okay, very good. So, so this is just a small cartoon kind of diagram here. This one that you see here, I'm just going to let me just make it bigger. So the prostate is a small gland that is below the bladder. So this is the bladder, this is the prostate, and from the bladder, the tube that comes out is the urethra, and these are testicles. That is, the testicles, and from the testicles here, the vas deferens coming back here, and then the vas deferens joins the seminal vesicle, and they both join the prostate. So first point that you have to understand is, there is no prostate in women. Only men have the prostate, right? So women don't have prostate. Next, I'll show you another diagram. Are you able to see this diagram?
Yes, sir.
Yes, sir.
Yeah, very good. Okay. So this is a sidewise view of the bladder and the prostate and the urethra. So there you see the bladder, and just below the bladder, that's like a century kind of organ this prostate is, and the urethra passes through the prostate and goes to the urethra. What goes outside? Now, what is the normal size of the prostate? It is about the size of a small lemon, right? Now, this prostate has the potential to grow throughout life. It is the only organ that can grow throughout life. So, you know, our fingers stop growing after the age of 18, 20 or something like that. You know, we stop growing, don't we? Right? One second.
Presentation.
Okay. So we stop growing at about 20 years, 21 years, don't we? Maximum, right? After that, we don't see our hands grow any, you know, we may become fat, but we don't generally grow. Okay. Now, the prostate is an organ that grows throughout life for males, right? At 20 years, it may be 20 grams. At 40 years, maybe 40 grams. And as we grow older, the prostate grows along with us. Okay, so that is the only organ in the body that can do that. And because it grows, it causes trouble at a later date. So here again, there's another cartoon that shows us where this prostate exactly is. And one second, yeah, there you go. I'm not able to see my, okay. So you see, it's very close to the bladder, don't you? Right? And the urethra is all around the urethra. So if the prostate grows, it is very easily can block the urethra. Okay? So that's one important point that we need to understand. Okay? It can potentially block the urethra. And because of this, it causes a lot of trouble. Okay? Okay. The next is there are 4 areas in the prostate. Okay, one is called the peripheral zone, one is called the transition zone, one is called the central zone. Now, can you see all the 4 areas of the prostate?
Yes, sir.
Yeah, very good. Okay, so why is this important? Because, sir, all of these areas cause different sort of problems. In the peripheral zone, most of the problem is from cancer prostate. In the transitional zone and the central zone, most of the problem is from the benign enlargement of the prostate. So when this prostate grows, it causes urinary problems. People will not be able to pass urine because it obstructs the urethra. The growing part of the prostate is the transitional zone and the central zone for benign conditions of the prostate. The cancerous part of the prostate is more in the peripheral zone of the prostate. So that's something that we need to understand. Okay, so what does the prostate do? What is the function of the prostate? I'm trying to get my mouse out here. Dhanshekar, can you please give me a mouse? So the next step is, what is the function of the prostate? Now, if you have the prostate, it produces semen. Now, a lot of the semen is composed of fluid from the prostate. About 60% of the fluid in the semen, the white discharge, which happens when men ejaculate, 50 to 60% of that is composed of fluid from the prostate and seminal vesicles, and a lot rest of it is from the sperms that come out from the testicle. So it is a fluid that nourishes the sperms. When the sperms come out, it is a fluid that nourishes the sperms. It needs nutrition. The sperms need nutrition as they travel. So they will need to be nourished, and that is where the prostate comes into play. Okay? The prostatic secretion. So it is a sexual organ, the prostate. One second. Just 1 second, give me 1 minute. I will trying to get the video to work. The mode. இப்போ என்னோட ஸ்க்ரீன் கையில் பாரு, புது ஷேரை கொடுக்குறேன்.
அதில் போயிட்டு இந்த பர்டிகுலர் அட்வான்ஸ் பண்ணுங்க சார். அட்வான்ஸ் கிளிக்
ஓகே,
இப்போ இந்த இடத்துல ப்ளே பண்ணாரு அதுக்குள்ளே வந்துடும்.
பரவாயில்ல, இது போதும்.
இல்லை சார், இப்போ உங்கள் ஃபேஸ் தெரியாது சார். உங்கள் ஃபேஸ் தெரியாது சார். நீங்கள் இப்போ இது ப்ளே தான் பண்ணுங்க சார்.
பாரு, தெரியல, ஃபேஸ் தெரியலன்னா பரவாயில்ல.
ரெஹன் சொல்யூஷன் சார். இப்போ ப்ளே பண்ணுங்க சார், அதுக்குள்ளே வந்துடும் நினைக்கிறேன்.
முதல்ல பார்த்துக்கணும்.
ப்ளே சார்.
இது போதுப்பா, இப்படி வந்த போதும். ஃபேஸ் வந்தா பார்த்துக்கோ. Can you see me as well as the screen, please?
We can only see the screen, sir.
Huh?
We can only see the screen.
You see the screen, okay, good.
Sir, your video. I think you should switch it off.
I'm sorry?
Your video is switched off, so we are not able to see your face.
I have switched it on. I can see my face here. I'm not sure why I'm not able to see.
We are able to see Curi Hospital logo, but we are not able to see your face.
Okay. You able to see me now?
No, sir.
Curi Hospital logo.
It's going to rain for next 2 days.
இப்ப தெரியுதாமா? நான் தெரியுறேனா?
இல்ல சார்.
சார் ப்ளே பண்ணாத சார்.
ஓகே, இருங்க, ப்ளே பண்றேன். இப்ப தெரியுறேனா?
No, sir. No.
சரி, பரவாயில்லப்பா, இந்த பாடம் தானே, நான் தெரியணும்னு அவசியம் இல்லை. இது ஸ்கிரீன்.
Sir, actually your video is off, sir. I'm just able to see your video is off. It has to be switched on.
Start my.
Yeah, now we can see you, sir. Yeah.
No.
We can see you, sir. Now we can see your some technical person. We can see them.
Okay. Just 1 second. Nanshankar,
Sir, don't.
Abdina, you have to stop your screen share, and then I'll have to start my screen share. That is the way it can work. Okay, stop your screen share.
Okay.
Okay, let's go ahead. I don't think we should be wasting time.
Okay.
Please continue, sir.
Can you hear me now?
Yeah, we can hear you, sir. Please go on.
Okay, right. So before the next prostate session, maybe I'll organize something that you see us as well. Right? So this is the point that I wanted to say. Can you see the slide pathophysiology?
Yes.
Just
Okay. Right. So the pathophysiology is important to understand what is happening in the prostate. Number one is, yeah, there you go. This part I wanted to see. One is if the prostate is normal, the urethral component, this yellow part is the area, the center part is the urethra, the yellow part surrounding it is the transition zone and the central zone. So if there is a small amount of enlargement, if there's a small amount of enlargement, it will not obstruct the urethra. Larger enlargements will obstruct the urethra. So now you see this cartoon here, it looks like an elephant with its trunk and all that. So number one is you have an elephant is able to imagine that elephant is the head of the elephant is the bladder and the trunk of the elephant is the urethra. So if there is a small benign prostatic hyperplasia, there is some obstruction. When it becomes enlarged, there is a bigger obstruction. And when it is completely obstructed, you see that the elephant completely not able to pass urine. Exact same thing happens in prostatic enlargement as well. Small enlargements cause minimal obstruction, while large enlargements cause complete obstructions. Okay. So the next step is pathophysiology. Again, when you talk about pathophysiology, there is static and dynamic obstruction, the epithelial and stromal hyperplasia. But more importantly, a lot of people ask me this question. Sir, my uncle had a very small prostate, but he could not pass urine. My other uncle had a very big prostate, more than 60, 70 grams, but he's able to pass urine very well. So it is not only the size that matters, it also is the amount of tension within the gland. Some people might have a very small prostate but cause an obstruction. Some people may have a very big prostate but no obstruction at all. So again, it's not only the size, but the tension within the prostate that makes the difference. Okay. So now this is a very, very nice picture. It shows the dynamic component and static component. Dynamic component deals with the tension of the prostate. Static component deals with the size of the prostate. So when you're treating this, also the same thing will apply. Dynamic component, you have to take medications that reduce the tension in the prostate. And static component, you should take medications that reduce the size of the prostate. This is how prostate is treated with medical management. Okay, so this is very important slide. If you look at the problem, all men above the age of 40 years can have lower urinary tract symptoms. Okay, one second. And then some of the men have, one second, let me just. Right, okay. So some of the men have histological BPH. Some of the men have lower urinary tract symptoms bother. Some of the men have bladder outlet obstruction. Some of the men have benign enlargement of prostate. So everybody above the age of prostate will have some sort of trouble. Above the age of 40 will have some sort of trouble with the prostate. But not all of these patients need treatment. The treatment is based on the symptomatology of the patient. Okay. Is this screen, can you see the screen now?
yes, sir.
Yes. So you have the screen where you see the problem, these multiple circles and all that. Yes?
Yes, sir. Yes.
Very good. That's it. Okay. Next we come to treatment. So I told you size alone does not matter. What else matters is how much of problem does this prostate cause to the patient matters. How do you know how much trouble? See, somebody can come and say, doctor, I have a lot of trouble with the prostate, but then he may not have any enlargement at all. So somebody who's severe trouble, maybe somebody's mild trouble. So we cannot go with subjective evidence. We cannot just ask the patient how much trouble, and then whatever he says, we cannot go through that. We also have to have objective evidence. For that, there is a symptom score. It is called IPSS score, International Prostate Symptom Score. It is available on the net. You just click it, you will get it. So all patients with this prostate enlargement trouble, we'll ask them to fill it. If they have symptoms which is less than 7, mark with that. Then it is mild symptoms. Moderate to severe symptoms, go to symptom above 8. So only moderate to severe symptoms will need treatment. Everybody else can be managed medically. Severe symptoms may need medical plus or minus surgical management. Okay. So next is this slide. So can you see this? It is benign prostatic hypertrophy. This is the view that you see when you see with a camera. Okay. And this is the view that you see when you see with the ultrasound. You see this prostate has grown into the bladder. Can you see this picture?
Yes, sir.
Very good. Okay. The next is proliferation of glandular tissue. This is a CT scan picture. Again, this is a camera picture. Can you see this part is the prostate, this part is the bladder. The prostate has grown slightly into the bladder. So this is what causes the problems for all men. What sort of problems? You know, all men, when they have BPH or benign prostatic hypertrophy or prostate trouble, will complain of frequency, regularly going to the toilet. Night they have to get up 3 or 4 times. The urine speed is very low. It's understandable because the prostate is causing an obstruction and the urine speed is very, very low. Okay. The other problems is they can have infection because of the prostate. Prostatitis can be there. Urinary tract infection can come because the prostate is obstructed. And then some bleeding can come. And because the prostate is obstructed, there's also stones can form in the bladder because the prostate is a sentry, right? Only when it opens, urine can come out. If it doesn't open very well, urine stagnates in the bladder and causes stones, infection, bleeding, and those sort of trouble. So when people have these sort of trouble, then they come to us for treatment. How do we evaluate them? Number 1, we ask them their symptom score, ask them to fill out the symptom score. Number 2, then we have to look at these are the symptoms: weak stream, hesitancy, sense of incomplete emptying, intermittent stream, prolonged urination, right? These are the symptoms that we need to be looking at. The next step is potential complications. So now when somebody is completely obstructed, they will have urinary retention. They cannot pass urine, right? Number 2 is urinary tract infection. Number 3 is bladder stones. Number 4 is recurrent bleeding. Number 5, because their urine flow is obstructed and their retention, there is back pressure effect to the kidney and causes renal failure. So we should not allow any persons with renal dysfunction to go without treatment. So if somebody comes to us with these 4 or 5 problems like renal failure, urinary retention, UTI, recurrent UTI, bladder stones, recurrent hematuria, these need mandatory treatment. Okay. Right. Another picture showing this is an example of a stone inside the bladder because he's not been able to pass. And then if it's delayed treatment, they can also form diverticulums in the bladder, which will cause more and more trouble. Okay. How do we assess these symptoms? Right. There are certain tests that we need to do. One is the symptom score, other is the history, other is a detailed examination, and then rectal examination. How do we feel the prostate? The only way to feel the prostate is with doing a digital rectal examination, where we'll put our finger through the back passage and have a look at the prostate of the patient. Okay. The prostate can be felt through the rectal examination, right? Because it is so closely approximated to the rectum, right? Then we have to do a urine test, then a uroflow test. I told you, the American Urological Symptom Index or the International Prostate Symptom Score. This is very important. It gives us an objective evidence. So anybody coming in, we'll have an objective evidence. His score is 7, his score is 8, his score is 10, and so on, right? It's been a validated questionnaire and it's very easy to get the patient to do it. Okay, I won't go into the details of that. Then this is important, I told you. Why is the prostate so easily felt? Because it's closely approximated to the rectum. So when you put your finger through the back passage, you can easily feel the prostate. And when you feel the prostate, there are several things that you can get from it. One is you can more or less tell the size of the prostate. Number two is you can tell the consistency of the prostate. If it is it's a benign feeling, which means it will be soft, which is very hard prostate, then it means that it can have cancer. So doing digital rectal examination gives us a very, very important idea about the nature of the prostate. Okay, so see this picture. The digital rectal examination has to be done very gently. That is important. We have to first tell the patients as nurses and nursing team leaders, you're going to be asked to explain to the patient what a digital rectal examination is. Digital meaning digit is your finger and rectal examination. So you have to tell the patient might be mildly uncomfortable. They'll use a lot of lubricating jelly and lignocaine jelly can be used, and then they'll feel your prostate. So it might feel a bit uncomfortable, but it won't hurt too much. If we explain this to the patient very carefully, then they will be relaxed and they will undergo the procedure without any trouble. If we don't explain it to them and the doctor directly comes and does it, then the patient may be very anxious and be in a lot of trouble. So it is very important that we explain to the patient what we're dealing with. Okay, so I told you what we're going to feel with the prostate. The possible things that we'll feel is it could be normal prostate, there could be tenderness, which means there could be infection. Then it could be by enlarged prostate, which can happen in benign cases. Asymmetrical induration nodularity you expect in malignant cases. Okay, right? So additional testing is something called uroflow. Uroflow is important where people will ask, the patient is asked to pass urine into a container, and once they pass urine into the container, it will give a graph like this. This graph we'll be able to find out and tell the patient whether they're obstructed or not. Again, it's another objective evidence of whether the patient is obstructed or not. This is very important to understand. Okay, so and the nursing team will be asked to do the uroflow most often. So the uroflow has to be done. So more importantly, the patient has to be explained what is expected out of him. Number one, he has to pass urine only into that container. It's very difficult for a lot of people to pass purely into the container. They may pass all around, but it's okay. Majority of it, they should be passing into the container, and they should start when we ask them to and stop when they complete their urination. Some people will have a hesitancy, which means when they go stand there, they may not be able to pass. The nurse who's doing the uroflow should be aware of all these things and ask them to give us an give the nurse an indication when he starts to pass the urine, so that they'll switch the machine on. Okay, so uroflow is very, very important. As from the nursing team, you need to know this well, right? So these are a series of questions that you need to answer. Is BPH, that is benign prostatic hyperplasia, a progressive disorder? Yes, it's a slowly progressive disorder, but not all patients will progress. It is not that everybody above the age of 40, 50, 60 will develop BPH. Some people will develop it, some people may not. Okay. What are the predictors of progression? How severe their symptoms are. And if they have a peak flow rate, that is PFR is peak flow rate. So, you know, in lot of, in children, when you see school children in the age of 5, 6 or 7, they all, you know, how fast they can pass urine. They'll be standing about 3 or 4 feet away from the wall, and they'll be hitting the wall with the urine stream, right? But as people grow older, that stream will come down. And as they become age of 70, then it will slowly start falling only at their legs level. Okay. So this is one important indicator. If the speed of the urine flow is coming down, then it's a good chance they're going to progress. What other signs of progression? The size of the prostate. The bigger the size, the chances of retention are higher. Okay. So next we go to treatment options, right? So this is a very important tabular column. Mild symptoms, reassurance, and observation. Right? So you have this IPSS symptom score, which is less than 7. Or the patient comes and says, I'm coming for a mastoral checkup, sir, I have mild problem with urination, then we can wait and watch. Moderate symptoms, if they're in trouble, they're saying this constantly making them get up. Then medical therapy. or minimally invasive or TURP. Then severe symptoms, they have to undergo surgical intervention, most likely. Okay, this is something we need to understand. Right? Again, this is similar to what I said before, treatment options for BPH. So first I told you about medical therapy, isn't it? Medical therapy, there are two types of medical therapy. I'm going back to one previous slide that I showed you just to show this point. Right? This is the point that I wanted you to understand. Number one is the dynamic component for which alpha blockers are given. Number two is the static component, which is the size of the prostate, for which 5-alpha reductase inhibitors is given. So I'll go back to this current slide that we're talking about. So because why we give alpha blockers? Alpha blockers have the smooth muscle relaxation potential. So the smooth muscles within the prostate and the bladder neck are responsible for the obstructive. Just one second. Okay. Right? The smooth muscles are responsible for the obstructive component of the prostate. Okay. So the dynamic component. So what we do is we give alpha blockers to relax this. Next, we go on to the 5-alpha reductase inhibitors, which reduce the size of the prostate. So two medicines we can give. Smooth muscle relaxation, that is alpha blockers, and then the 5-alpha reductase that reduce the size of the prostate. That is all we need to know about medical management. Now, surgical management of the prostate is again very, very simple. When we do surgical management, when they have moderate or severe bothersome symptoms. What is the most commonest surgery done for prostate hypertrophy? Benign. And more than 85% will have this surgery called TURP. Now, this TURP can be done conventional by a cautery method, or it can be done with a laser as well. So I'm going to show you a video of how the TURP is done. So can you see this? There is a camera put through into the bladder and the prostate will be scraped out. Okay, and there's a small video here that's shown here. I hope you're able to see the video. Can you see the video?
Yes, sir.
Yes, sir.
Yes, go. So we are going into the bladder now. We are going through the prostate. That is the prostate that is obstructed. Can you see that? That part is the obstructed prostate. Can you see that part? Okay.
Yes,
and slowly we have a cautery loop with us. And slowly you can see that prostate causing obstruction. And so in Tamil, when you take out the prostate, coconut, it's called Tenga Thiruvarudhu, something similar we will do inside and remove bits of the prostate. It is mechanically, it is something similar. All we need to do is cut out bits of the prostate so that the passage becomes better. Can you see this? It's a very good video demonstrating how we remove bits of the prostate. Once we remove bits of the prostate, then the passage becomes free and the patient will be able to pass urine very well. Okay? The larger the size of the prostate, the longer this removal takes. Right? We usually give a limit of about 1 hour for us to resect it. And usually size is below the size of 80 to 90 gram prostate. 80 gram prostate we can easily remove by the endoscopic method. If it becomes a bigger prostate, then we do either open surgery or we can do it with robotic surgery for prostate removal. In fact, robotic surgery, the patients need to stay only 1 day in the hospital. And this is conventional. What the video that you're seeing now is conventional TURP. Can you see that? So we've removed a bit of the prostate now. The opening has become much bigger and the patient will be able to pass urine. It's just simple mechanics. The pipe is blocked and we are opening the pipe. Very simple. Right? That is how TURP is being done. Now, when you see the end of the video, you'll see that it's completely open to the urinary flow. Right? That is one of the best and easiest ways of removing the prostate. It's probably one of the most commonest operations that you will see if you're working in a urology operating room. Okay? So, let me summarize a bit for you regarding benign prostatic hypertrophy. Number one is we talked about what is the prostate, right? Prostate is a small gland where it is below the bladder and is responsible for production some of the seminal fluid. Number two is what kind of problems will the prostate cause? It can grow bigger and it will obstruct the urinary passage. And number 3 is, what are the treatment options, or how do we evaluate it? We do ultrasound, we do uroflow, we do the IPSS score. And then if the patient has bothersome symptoms, number 1, we try medical management. Medical management, there is 2 types. One is we can give medicines to relax the prostate. Number 2 is we can give medicines to reduce the size of the prostate. If the medicines don't work, then surgical intervention is needed, and the commonest surgical intervention for the prostate is TURP. Conventional method is being shown, but it can also be done with a laser TURP. Okay. Thank you. Now next we will go to prostate cancer. Okay. Can you see this video? Can you see the screen?
Yes, sir.
Prostate cancer?
Yes, sir.
Yes, very good, very good. Okay. Now, number 1, before we go into what is prostate cancer management options and all that, I need to tell you what cancer is, right? Cancer is all cells in the body. They continuously develop, multiply, and then they finally die. If one cell forgets how to die and continuously multiplies, then it's said to be cancerous cell. If this cancer happens in the prostate, it is prostate cancer, right? I showed you before in the BPH video, BPH slide. In fact, I can go back and show you that slide. 1 second. Yeah, I told you there are 4 areas in the prostate, didn't I? So the transition zone, central zone are responsible for the benign parts of the prostate. This peripheral zone is the area that is responsible for cancers of the prostate. Okay, so most of the cancers, more than 75% of the cancers, form in the peripheral zone of the prostate. Okay, so a cell that has forgotten how to die, that is cancer, that happens in the prostate, it's prostate cancer. Okay. Who develops prostate cancer? What is the most common reason for developing prostate cancer? Prostate cancer is again a disease of the old age. Okay, above the age of 60, more people develop prostate cancer. As you grow older, there are chances of developing prostate cancer. Even benign prostatic hypertrophy also occurs in the older age group, but there is a difference, right? Not all hypertrophies of the prostate become cancerous. Okay, that's important to understand. It is not like a progression. People with big prostates not automatically develop prostate cancer. Hypertrophy is a separate phenomenon, and then hyperplasia, and then cancer is a separate phenomenon. Both can occur in the prostate. That is all. Okay. So, how do we deal with this prostate cancer? What do we do for prostate cancer? Number 1, can you see the screen with the algorithm here, or the? Can you see this?
Yes, sir.
Yes, okay. So first step is presentation. What are the symptoms that they'll usually present with, right? So most of the people with prostate cancer will present with symptoms that are similar to BPH. Okay, they will have some sort of trouble passing urine. So they will come to a doctor. And when the doctor feels the prostate, they may think, I told you before, if it is a benign hypertrophy, then it's soft. That feels like, the prostate feels a bit soft. But if it is cancer, it feels firm to hard. So the doctor might feel the prostate and then say, well, it looks like cancer, and then evaluate it further. A lot of times patients may not have any symptoms and they may come to us in a late stage. So how do you evaluate potential prostate cancer? We will get a blood test done called PSA, prostate specific antigen. It's a very important blood test. So most of the patients who walk into a urologist clinic above the age of 40 will usually have this PSA test done. It is a blood test and it tells us whether there is anything wrong with the prostate. Normal value is less than 4. If the value becomes more than 4, then we have to evaluate for prostate cancer, right? How do we evaluate for prostate cancer, right? Now we usually do a biopsy of the prostate, okay? Now I'll talk to you a little bit more about it. So can you see this investigations and diagnosis? Yes?
We could.
Yes, sir.
Okay, so you're able to see all the slides, but you're only not able to see my face.
No, sir, only we are not able to see your face, but rest, all your slides are very clear, sir.
Madam, more important to see the slides.
Miss pandrome.
So number one is the digital rectal examination. I told you the BPH slide, this digital rectal examination forms an invaluable part of the examination for a urologist, right? So it's very, very important that we do a digital rectal examination to find out how the prostate feels. Next is the PSA, and that gives it, that is a yes or no answer. If the PSA is below 4, we can wait. Above 4, then we go and do a biopsy. How do we do a biopsy? It's usually a transrectal biopsy of the prostate, right? Nowadays, there's one extra step before we think of a biopsy. We do an MRI to find out whether there's anything wrong with the prostate, and it also tells us where in the prostate we need to take the biopsies. And bone scan is for late stage to find out whether the cancer has spread beyond the prostate. Okay, so all cancers will spread. By nature, if you need to call something a cancer, one of the important things is for it is to grow continuously and spread to other parts of the body. This spreading to other parts of the body is called metastasis. So that is important for us to understand. Now, first step is transrectal ultrasound scan. It is an outpatient procedure, and as nurses, you'll be very closely involved with this. Now, there is a leaflet that I can send to you from Curi Hospital. All of you who are attending this webinar will be given that leaflet. It is a leaflet that tells us how to do a transrectal ultrasound of the prostate or transperineal ultrasound of the prostate and take biopsies from the prostate. Okay. So you read that leaflet, and next session, if you have any doubts, we'll be happy to answer. Right? So this is how the biopsy is being done. Ultrasound machine, all of you have seen. The biopsy, the patient is in the left lateral position, and we will put a probe through the prostate, to the back passage, and take biopsies out of the prostate, right? So this is how an ultrasound image looks. And this is the biopsy gun that is needed. And the core that comes out of the prostate is like this. It's about 1.5 to 2 centimeters. And the pathologist looks at this core and tells us whether there is cancer in the prostate or not. Okay, this is how we diagnose prostate cancer. Next is staging of prostate cancer. For any cancer, anywhere in the body, we need to find out if the cancer is only in that organ or is spread beyond that organ. If the cancer is only in that organ, then it is more or less usually curable. If the cancer has spread beyond the confines of the organ, it will become more difficult to cure it, but we can only control it, right? So the MRI is a good way of staging. Then you have PSMA PET scan can be done. Then you have bone scan that can also be done. Here you see a patient who's got multiple bone metastasis, right? He's completely gone to all parts of the body. This is not a curable situation. You can only control this sort of a cancer, okay? So the next step I'm going to show you is, we'll quickly, I think we're running short of time. We'll quickly go to areas that I want you to look at. Yeah, this is the one, okay? So I told you what is prostate cancer. Number 2 is what are the tests that are done, that is PSA, transrectal ultrasound, staging with PET scan, MRI, etc. Then once we know the staging where the cancer is localized or spread outside the prostate, then we have different ways of treatment. Now if it is organ confined prostate cancer, which means the cancer is only within the prostate, then you can cure the cancer potentially with surgery, and is robotic surgery. I think if you've seen the last talk that I gave, it was on robotic surgery, and we showed you a radical prostatectomy. It is one of the best ways to do prostate cancer surgery, right? Then we can also have irradiation for the prostate. What about locally advanced? Again, surgery and radiation form major components. What about if the cancer is spread outside the confines of the prostate, right? This situation, you cannot cure the cancer. If it is already metastatic to different parts of the body, then you can only control the cancer. Now, the good thing about prostate cancer is it is hormone dependent cancer. Sorry. One other cancer in our body that is hormone dependent is breast cancer. So these two cancers are hormone dependent cancers, which means hormonal manipulation now can control the cancer. Now the prostate that you have, prostate cancer, can be controlled by reducing the amount of testosterone in the body. How can you do the reducing? How can you reduce the amount of testosterone in the body? Testosterone is produced by testis. So if you remove the testis of the patient, it's called castration, then you can control this cancer, right? And at a late stage, these patients will develop hormone-resistant prostate cancer. So there are 4 components. One is organ confined, where robotic surgery is ideal, and locally advanced, slightly spread beyond the prostate, where surgery and radiation may be used. Metastatic, where it's spread to different parts of the body, where only hormone treatment can be given. And the most commonest hormone treatment in our country is removal of the testis or surgical castration. There are also other ways of doing castration, which is called medical castration, where they have to be given an injection called the LHRH injection that will have to be given lifelong. But because of the cost implications, in our country, the most commonest procedure for metastatic prostate cancer is hormonal manipulation. And finally, when you have hormone resistant, so I told you when you do hormonal manipulation, you can only control it and control it for a finite period of time. For some people, it may be 5 years, some people, it may be 10 years. Once that happens, then it becomes hormone resistant, and then you may need to give chemotherapy and so on, right? So this is what I wanted to talk to you about: benign hypertrophy of prostate and cancer prostate. And finally, to end with, I told you India is a country that is relatively, I would say, not a rich country. So orchidectomy is one of the most commonest ways of treating metastatic prostate cancer. But if it is localized, then orchidectomy should not be done. You have to give them a curative treatment option, which is probably robotic surgery or radiation. Right? This is just a diagram. We don't do this ever. So don't think this is how orchidectomy is done. Thank you very much. Thank you for taking time off to come and listen to this lecture. I'm happy to answer any questions that you may have.
Thank you all for listening. Any questions?
Thank you all for listening. Any questions?
I think in the chat it may be seen, Raman.
You can see, sir. Chat, you can see, sir, the questions. So, yeah. How about the early identification of prostate cancer, sir? Is it happening in India?
Who has asked that question?
Sir, so I mean, name is not there.
The institute name is Intel.
So it's a very good question. So it's important for us to understand that there is something called a screening protocol. So all the rich countries in the world used to do the screening before, where they will screen everybody above the age of 45, 50 every year, get a PSA blood test, and then try and get more people diagnosed at an early stage to come and get treatment done. But in India, we don't have that ability. Okay, so that is one of the biggest problems. We are seeing more and more patients who come at a later stage. So that is one of the troubles. So if you ask me, more than 80% of patients who come with prostate cancer come with later stage. So one thing that you can do to share to other people is, if they have low urinary tract symptoms, any problems passing urine, then you need to ask them to get a PSA test done if they're above the age of 40, 45. Very, very important. Okay.
The next question is: prostate artery embolization beneficial in BPH?
Fantastic question. Who asked this question?
Shahul Hamid.
Very good question. So, yeah, now I think I can see myself.
Okay.
Again.
Are you able to see me?
Yes, sir.
Finally, see? Okay. So the prostatic artery embolization is something new that's been found. What they're doing there is, we have done it 1 or 2 times here in India as well. The idea behind that is we embolize the major vessels that go to the prostate, and as a result, the prostate shrinks. Okay. Can it be done? Yes, it can be done. But long-term results of prostatic artery embolization not been validated yet in several countries around the world. And number 2 is, currently as it stands now, it is quite expensive, right? Because so TURP, you have this experience all around the country. It's done in most centers. When you need prostatic artery embolization, there are specific indications. Certain median lobes of the prostate cannot be treated by that. So again, there is a problem, but it can be done. What's the next question?
Yeah. In United States, 1 among 5 men, but in India, registries are lesser. What is the reason for that? Ratna Kumar.
1 among 5 men?
1 among 5 men. In United States, 1 among 5 men, but in India, registries.
I'm assuming you're talking about prostate cancer, Ratna Kumar, so I'll answer this that way. So the incidence of cancer in India, prostate cancer in India, is lesser when you compare it to America. Now, one of the reasons that you said is the number of registries are lower. It could be a reason. I suspect more important reason is the disease process itself is different. It occurs more in elder age groups. The race is also important. Indians don't develop prostate cancer as much as Americans do. So in America, there's 150 per 100,000. In India, it's 20 to 30 per 100,000. Because the population of India is about 5 times higher than the US, we see probably the same number of cases as in America. But if you take Americans in general, they develop more prostate cancer compared to Indians.
There's one question from Lieutenant Colonel Regina. Is there robotic surgery for treating BPH?
Very good question. If I have the time, I can show you a video. So again, Lieutenant Colonel Regina Verma.
Yes, sir.
Yeah. So it's important that TURP can cure cancer, the BPH for up to 80 gram to 100 gram. Now, above that, 100 to 120 can be done with lasers, and higher can also be done with lasers. But if there are bigger prostates, right, then it's far better done with open prostatectomy or with robotic surgery. So we've done quite a few cases where the patient needed to have surgery for robotic surgery for BPH. Now you also get several patients with a large prostate and a big diverticulum of the prostate as well. In fact, not diverticulum of the prostate, diverticulum in the bladder. So these are situations where you will take out the prostate with robotic surgery and as well cut out the diverticulum with robotic surgery. This cannot be done with laser, TURP, anything of that sort. If you are going to do something for the diverticulum, then at the same time you can do something for the prostate. And this is one of the prime indications for robotic simple prostatectomy. So robotic radical prostatectomy is done for cancer prostate. Robotic simple prostatectomy is done for big prostates, which you think you may not be able to do with TURP, or you may need 2 sittings with TURP. You can do with a single sitting in robotic surgery.
So there's one more question. Is there a possibility of recurrence of prostatic symptoms 5 years after TURP and the need for continuation of Urimax in such patient? This is by Jelena Nyanarani.
Right, good question. So usually when we do TURP, the symptoms don't come back for 10 to 15 years minimum. But it also depends on how fast the prostate grows back. If somebody has a very fast prostate growth, then we need to look at that. Number 2 is, if after having a TURP they have low urinary tract symptoms, you have to evaluate for cancer prostate as well. Right? Number 3 is, After doing TURP, there are chances of developing stricture. Stricture in the urethra. Stricture is blockage. Stricture in the urethra and in the bladder neck. So this may not work very well with Urimax. For that, you need to put a camera and have a look and find out where the stricture is and treat it accordingly. So 3 reasons. Evaluate for CA prostate, make sure there's no stricture, and that he doesn't have a very fast prostate growth.
One last vital question, sir. Whether TURP will affect the sexual health of patient. It's same person intel.
Okay, so good point. So I think when you're talking about sexual function, there are 2 components that you need to understand. One is erections. Number 2 is ejaculation. Erection is the penis becoming hard. Ejaculation is when semen comes out, right? Now, when we are cutting out parts of the prostate, the bladder neck and prostate, when we do TURP, the semen that is produced in the prostate is going to be lower because you are removing parts of the prostate. Number 2 is when you compromise the bladder neck, the semen that comes when you ejaculate goes into the bladder rather than coming outside. This is called retrograde ejaculation. So retrograde ejaculation is very common after TURP. So if somebody has not completed their family, then TURP should not be done. If they want to have more children, then it's better not to do TURP, right? But usually this occurs in people who are 60s and 65s and so on. So it's usually not a problem, the retrograde ejaculation. But before we do TURP, they should be explained about the possibility of retrograde ejaculation before we operate. Number 2 is about erections. Very small percentage, less than 1% of people can have some erectile dysfunction after TURP. And that is usually amenable to medical management, should be combated.
Thank you very much, sir. It was very informative. I hope everybody enjoyed it. Thank you very much, sir.
Thank you. Thank you for coming. Thank you. Bye.
Thank you, everybody. I hope this session was very informative for you all. Now, we have shared cohort PIN number with you. You can proceed and start answering the questions. You have time up to 5 p.m. only. And I'm sure for 25 questions, which is objective type, you can finish in 45 minutes. Thank you very much.
Yeah,